Hello, welcome to another video from Dr. Blake's Healing Soul. This is Dr. Rich Blake from San Francisco, and we're going to show you neural flossing. Podiatrists treat all sorts of nerve pain in the foot, Morton's neuromas, tarsal tunnel syndrome, and other nerve entrapments. And neural flossing has proved to be wonderful at relieving the tension in the nerves, and especially when it's a double crush where some of the pain is coming from the back or the buttocks or the hamstrings where the sciatic nerve is binding up. I've even had patients where the pain is coming from their neck and influencing the pain in their foot. So Pat here will show neural flossing in its basic amount of sets and reps. So Pat, demonstrate first the neural flossing exercise. So it's you trap the opposite side against the ground and you go through 10 repetitions of maximum flexion to maximum extension. So here she's flexing her hip, her knee, her ankle, and her foot, and she works through the 10 reps. You're not supposed to stop along the way, and I tell people to lead with their foot. You're also not supposed to lift your pelvis off because you want your spine and your pelvis to be in solid neutral position. So you go through these 10 reps about 3 times a day of maximum pointing and maximum flexion. And then one of the provocations is where every time you point your foot, you look at your foot with your neck. So you're bending your neck as you point, and that's putting a little neural tension on the system. And that sometimes can cause a little bit more stimulation to the nerve. So every time you point, you're going to look. So here's Pat pointing and looking at the same time. And as she flexes, she puts her head down. As she points, she looks at her foot. Then 2 of the other provocations, the first is for the peroneal nerve, is when you point, you invert your foot. And that inversion of your foot every time you point produces a stretch on the peroneal tendon. So here she's coming down, and as she points her foot, she inverts it to stretch the lateral side or the outside of her foot. So that's another provocation. For the tarsal tunnel or the inside, you come down and you pronate your foot. And here Pat is demonstrating pronation. So you have to get where it's smooth, it's 10 rhythmical motions, and I always have people like start with just a basic neural flossing, and then add the provocation test to see if that gives them any different response. But I've had a lot of patients who that's really helped ease the symptoms around their nerves in their foot. Thank you very much, and I hope this was very helpful.